Assalamu alaikum. I am Dr. Mir Moyeedul Islam, Associate Professor of Pharmacology at the Sakina Women's Medical College, Jashore. In the previous discussion, we discussed about insulin structure, storage of insulin, secretion of insulin, regulation of insulin, and then we discussed about the insulin sources, insulin analogues. We know the different names of insulin analog. Why the insulin analog are so important, why we choose to use the insulin analog. Today we will discuss about it, and if we get further times, then we will discuss about the indications of insulin and the adverse effect of insulin. So, insulin analogues, there are different types of insulin analogues. So, one is rapid acting insulin analog, and these are insulin lispro, insulin aspart, and insulin glulysin. Insulin lispro is a one type of insulin analog in which the proline in B28 position is replaced by B29 position lysine. So that's why the name of insulin analog is insulin lispro. Insulin aspart is one type of insulin analog that is shorter acting, and it is also faster acting, and it is shorter duration of action. And this insulin aspart is a insulin analog that is produced by interchange. Proline B28 is replaced by aspartic acid. Intermediate acting insulin, and this is the neutral protamine hagidron, and it is the insulin that is intermediately acting insulin, and its duration of action is control of blood sugar level 5 to 8 hours. Another one is insulin long acting insulin, that is insulin glargine, insulin ditimir, and insulin digludec. Insulin glargine is an important insulin. Nowadays we used the long acting insulin. This insulin glargine is a soluble peakless long acting insulin. The rapid acting insulin is important for controlling our postprandial hyperglycemia. If we think there is pre-lunch random blood sugar level of a patient is increased, then we should think about the after meal or after breakfast meal there will be raise of blood sugar level. So we have to control this blood sugar level by giving rapid acting insulin. So that's why rapid acting insulin is important to controlling the postprandial hyperglycemia. The intermediate acting insulin nowadays is, if the type 2 diabetes mellitus or in type 1 diabetes mellitus, in type 2 when there is oral anti-diabetic drug agent to fail the control the blood sugar level, then the first choice of insulin is intermediate acting insulin, that is neutral protamine hagidron, but it has some limitations. The neutral protamine hagidron causes nocturnal hypoglycemia and morning hyperglycemia. If we control the nocturnal hypoglycemia and the morning hyperglycemia, we should choose the long acting insulin first. So in case of type 2 diabetes mellitus, if insulin is necessary to control the blood sugar level, we have to go for long acting insulin, and these long acting insulin have soluble peakless flat control of blood sugar level, and it also control the morning hyperglycemia also. Now the insulin regimen and insulin, the starting dose of insulin. Insulin starting dose is 0.2 international unit per kg body weight, and the first choice of insulin nowadays is intermediate acting insulin, and it is given 1 to 2 times daily. If there is any chance of nocturnal hypoglycemia or any morning hyperglycemia that is causing by the intermediate acting insulin, we have to go to the, we have to change this insulin, and we will give the long acting insulin. Now we will discuss about the indications of insulin. Indications of insulin are given in type 1 diabetes mellitus, in type 2 diabetes mellitus when oral anti-diabetic agent fail to control the blood sugar level. Then we go then we will use the gestational diabetes mellitus, and we give also insulin in a condition that is diabetes mellitus with different types of surgery in pre-operative, post-operative and peri-operative period. Sometimes diabetes mellitus with different type of complications we give insulin. As diabetic retinopathy, diabetic nephropathy, in diabetic ketoacidosis we choose insulin. There is another condition in which there is a electrolyte imbalance in our body, that is the hyperkalemia. We give the insulin also. So these are the important indications of insulin. The choice of route of insulin. Normally we use insulin in subcutaneous route, and for the defective absorption of insulin that causes the lipodystrophy, if we prevent lipodystrophy, we will rotate the site of insulin at a regular interval. The emergency period, such as in diabetic ketoacidosis and also in diabetic complication where there is an emergency arise, we give insulin in intravenous route. Insulin can be given in also by intramuscular route. These are the routes of administration of insulin. Now insulin delivery system. There are different type of insulin delivery system. One is needle and syringe giving insulin system, or sometimes it is called the conventional method, and we took the insulin from the insulin vial by a syringe, that is over there is a needle, and we took the insulin and give the subcutaneously this type of insulin. Another delivery system of insulin is called the insulin pen, where there is insulin mainly present into the cartridge of this insulin pen, and there are different types of cartridge. There is 100 international unit, or sometimes there is 50 international unit in this cartridge, and whatever the dose, and the dose is we can fix by changing the rotator in this insulin pen and give this insulin through subcutaneously. There is another method of delivery system of giving insulin, that is called continuous subcutaneous insulin infusion device. Another method of nowadays, it is a new method of giving insulin in a patient, that is one of the important delivery system of insulin, that is inhaled insulin. It is not available in Bangladesh, it is developed in UK and USA, and this insulin is called Technosphere insulin, or also the name of this insulin is called Afrezza. It is like a referee, it is like just like a referee blowing his whistle. It is one type of whistle, and this is the inhaled insulin, and this is the dose of insulin is sometimes the 4 international unit or 8 international unit, or sometimes it is 12 international unit. It is the rapid acting insulin are given over there, and these insulin are nowadays familiar to in Europe, but not present nowadays in our country. And this insulin cannot be given in types of in different situations, that is COPD in bronchial asthma, where there is a obstructive lung disease. We have to go first the FEV1 for this type of patient and see there is any obstructive disease over there. If there is any asthma present over in this type of diabetes mellitus patient, or there is COPD in this type of patient, we will never give this type of drug or this type of insulin. This inhaled insulin, there is a excipient which is 2 to 2.5 angstrom meter in diameter, and this excipient is called femoral diketopiperazine, which gives a more surface area that this insulin can easily absorb into the lungs, and through the pulmonary circulation it goes into the systemic circulation and controls our blood sugar level. So this is the Afrezza, and this is the important delivery system of insulin. Hope you will enjoy this session.